Hey you guys, welcome back to Two Dope Black Doulas. I'm Brittany Jones, and this is Danielle Watson Murray, and we
Yes,
are your
hello.
two dope black doulas. We wanted to talk about two different topics. I'm going to talk about self-advocacy during pregnancy, and Danielle's going to be talking about fertility in our community. But we wanted to just talk a little bit about that and discuss about what comes up in our community sometimes. So I'll let the floor to you, Danielle, for you to start
Okay.
talking about your topic.
Yeah, thank you, Brittany. So, fertility, I feel like, or infertility, is a big issue that I feel like just started bringing to the forefront for a lot of families. Do feel like, obviously, over the last, maybe years, Brittany, I feel like it's more of a conversation that's not as taboo, but in the Black community, especially, it is a lot more difficult. And I know just even working as a birth doula and going through our program, I did some more research even for myself, where a lot of this, I'm going laughing because a lot of it and a lot of things in America are based in slavery and patriarchy.
And
So,
racism
racism,
and
always.
transgenerational trauma that's been passed down.
All of that.
All the things.
All the things. I'm like, what does it stem from? Slavery,
Right,
racism.
right.
And a lot of it is really because, you know, as we know with slavery, African Americans were enslaved people, and Black women bodies were not theirs. They were used as pretty much labor tools,
Yeah, like
physically, sexually,
our bodies were
emotionally,
like we were legit valued based on our ability to give
to
birth. Like
give
if we
birth
couldn't give birth, we didn't have the same value and
literally.
worth than someone who could have babies.
Exactly. Populate and continue the labor force as much as possible. That's all they wanted from us. And then became very over sexualized. We talked a little bit about that during our breastfeeding journey podcast. So this has all the tie-ins of, again, slavery and racism. So realizing that it was more of, you look at a Black woman, she get pregnant, and that's another stereotype that carried on for generations, where we just have a lot of kids and we're welfare queens, all stereotypes
Yes.
that are totally incorrect. Hello.
Right.
Um,
Absolutely. Absolutely.
so, thinking that I know a lot of families, especially Black women, just say like, oh, whenever I do decide to have children, it's going to be, you meet the perfect person, you get married, you have children. And that's not always the case. Or sometimes you do meet someone and you don't get pregnant, or sometimes you get pregnant once and it doesn't stick, unfortunately. So a little bit of my personal journey, have a little bit of everything. We got pregnant very easily at 24 years old and straight out of college. And, we had our healthy baby boy. And then after he got a little bit older, we're like, we can give him a sibling. The fertility journey started there, or infertility, I should say, started there for us, where we just couldn't figure out why. We went to a few specialists, got a lot of tests done, and my husband and myself, and they were like, well, you're young, you're fit, there should be no reason. Everything is checking out. Ovaries, his part looked good, everything was great. So
Hmm.
it was more so of, as we got older, now we're 33, 34, and the 35 of, oh, now you're a geriatric pregnancy. Excuse me.
The term geriatric pregnancy always
I,
makes me cringe.
Brittany, let me tell you, I'm pretty sure I said to the doctor, I said, excuse you? It was, it was one of those automatic things where I didn't realize. I definitely had to check him. I said, excuse you. And he said,
Right.
I'm so sorry. I didn't, that's the term. I don't agree with it. I said, but you said, look at yourself.
You didn't even have to say it. Like if
You
you want to
did.
document it for your purposes and don't you could just
You
document
can
it
let
in
that in
the
the
chart
notes
and then don't say it out loud. Like it's fine. We don't need to hear
at all. Rude. I was taken aback.
that. Now let me ask you
Not,
something, Danielle. Sorry, I
yeah.
didn't mean to interject, but
No, go ahead.
So I've heard this before, and I don't know if this is true or not, and I
Yeah.
don't know if you've know this, on your fertility journey, but I have heard that the second time around trying to get pregnant, sometimes for some people some people have difficulty with that. I know I did. It took me some years to get pregnant with my daughter. So do you know if
Yeah.
that's true?
That's allegedly, I feel like one of my specialists told us that it actually does happen a little bit more difficult. It could be, and I remember one of the factors was it could be older, even if you're a year or two older, the amount of
Mm,
eggs that you lose can significantly impact it. Black women, especially, we get fibroids. I developed fibroids as well over the years. They, as in the specialist, said that they were small enough that they shouldn't have been impacting my ability to get pregnant, but it was there. I didn't have when I
right.
was, pregnant with my first son. So that is definitely a factor. Now they call it advanced maternal age instead of
Mm,
geriatric. So
hmm.
just a shout out to the medical community for somebody really saying like we probably shouldn't name it that. But yeah, second time, or unfortunately some people they get pregnant and it doesn't stick. Um we decided that once I had one little surgery, the laparoscopy, which was to kind of make sure everything on the inside was clear, then it was like, okay, if we don't get pregnant within these 3 or 4 months, we're going to look into IVF. And
Mm,
no joke, the third month, I got pregnant with
mm.
spontaneous twins.
Oh, wow.
Um,
Wow. It was like, no, here you go.
and
Double for your trouble. Here you go.
literally, that's exactly what I said the day we found out. I was like, oh, what? Mind you, twins do not run in any part of our family. So just put it out there. Even the specialist, I remember because we were at that point being a fertility specialist, going to the office and everything. And she was like, I don't see here that you started the drugs. I said, we didn't. It was like, ma'am, we did not. We did not. So yeah, God definitely gave us before our trouble. We went on to have twins. And it was again it's definitely what they call a spontaneous pregnancy. And it was great. And then again, at this point, we have 3 boys, and we're like, maybe we could try for a girl. Unfortunately, during the time of the babies, or the twins being like 1.5 to now, I had 2 miscarriages very early on. That was the only miscarriages I've had. And the specialists were always like, you never just even got pregnant and then lost it. And in my head, I was like, why would you want that for me? But we did have 2 early term losses. So that was rough because again, you don't really talk about it, especially when it's very early. You're just about 6 weeks. You're just like, okay, I'm starting to feel all of it. Pregnancy test is positive, and then bam, it's taken
Yeah.
away.
Yeah.
Um, my heart really goes out to all those families and the moms that deal with that. I know some people who've had, goodness, multiple losses.
Mm,
Um, Again, in the Black community, we don't talk about it enough because it's
we
just like,
don't.
oh, we get pregnant so easily. We have a lot of kids, and it's not the case.
Right.
It's
And
it's
it's
not.
almost like mental health in the
Yes.
Black community. It's like if you have trouble, conceiving, or if you have a mental health disorder, or substance use disorder, it's just looked on as like, what's wrong with you?
What's wrong with you?
Yeah, like
Yeah.
what happened to you? Or like,
Pray about it.
you
You'll be
know,
fine. And it's just like,
right.
we need to seek some therapists help.
Right. And I mean,
Yeah.
pray about it. Yes.
Additionally,
Absolutely
yes.
pray about it, but also it is absolutely fine to go see a therapist or to consult a fertility specialist or, you know, other things to help you, because I know sometimes
Hope.
when you kind of go down that journey of just praying about it, over time, if you're seeing no results, like you're like, well, first of all, is there something wrong with me? Is there something wrong with my
Right.
relationship with God? Because
Is this thing on? Is I'm praying?
it's like, okay, I'm praying and I'm praying and I'm praying, and I mean, so this is interesting. I never really talked about my fertility journey with my daughter, but I remember going to a fertility specialist after about a year and some change of not getting pregnant. And I was kind of like, why am I not getting
What's going
pregnant?
on?
I stopped birth
Right.
control. Like I thought as soon as I stopped, like it was going to happen, and it doesn't happen like that either.
And they tell us, like, some parents, we know this, they put the fear of God, and again,
Right.
being a Jamaican household, it was like, you look at a boy, you're gonna get pregnant.
Right.
See, and then when I need to get pregnant, it's a problem. Put it back.
Right, right. So I know we just went off of the like you said, the initial testings. Like we did the first testing
Yeah.
and everything, and it came down to testing my husband's sperm, and he was like, no, no, I'm good. We're gonna stop there.
Look, I'm not gonna, yeah. Look, my husband was willing to to
So
take
it
all
ended up just
measures.
being COVID and being at home 24/7 and
Hello.
like
That's why we got COVID babies. Hello.
so then I was like, oh, I'm I'm kind of like tired all the time in these meetings. And it wasn't until one of our psychiatrists, at the time I was working for a mental health facility. So one of the psychiatrists was like, okay, Brittany, like you got to stop yawning. Like you are like killing me. Like I'm trying to stay awake too, and you keep yawning. And I was like,
Look,
why do I keep yawning? Like I'm getting sleep.
he's so
Obviously, I'm
tired.
right. I'm just so tired. And come to find out, I came back the next week and I was like, yeah, so there's a reason why I'm yawning. And I just found out that I'm pregnant. So that's what it is.
You're welcome.
Thank you. But
That's so
we
funny.
like, we don't talk like going back to, the top, like we don't talk about those things. Like it's kind of like, I remember when
So
I was going
taboo.
through the fertility doctor, I kind of was like on the hush hush. I didn't want people to know that I was going to a fertility doctor. I was kind of like, yeah, I had to
Same.
go to the doctor today, like,
Yeah,
you know,
same. Oh my
because
gosh.
just worrying about like
Yeah.
what people were gonna say, like, oh, you can't get pregnant. What's wrong with you? Did you, and it's kind of like this like red scarlet letter on your head, like, what's wrong with you? Did you have some kind of, I don't know. I don't know what people think. Did they think there was something that happened to
Mhm.
you that prevented you from like, so
Being pregnant. And we
yeah.
actually, as African American women, which I found out again going through the doula work, everything, we actually suffer like almost 2 to 3 times more than white women in infertility. And I was like, what? And in some cases, 3 to 4 times, depending on like obviously like miscarriages versus early term. But yeah, we actually suffer at a higher rate. But if you think about it, and I don't know if this was your experience, Brittany, but even going to a fertility specialist, 9 out of 10 times, whenever myself or my husband and I went to any specialist, we were the only Black people in the room beside literally the
Yeah,
receptionist and the nurses.
absolutely.
And we went a
Absolutely.
few times. And I used to be like, maybe one other African American couple would be there.
I would see like you said, we would be the only like I was the only African American person in the room, but then you also saw like, other like nationalities. I don't, want to, I didn't ask them what their nationality was,
Right.
but more like your Indian, like of Indian descent, Indian heritage, like Middle Eastern
South
type of,
Asian, yeah. Nope.
yeah.
No,
Yeah.
it was again very taboo. When I know I have a few friends in the South Asian community as well. Very taboo,
Mm-hmm.
even more so than an African American community. So
Mm-hmm.
I think this is a good segue to talk about the therapy portion of it, because it's needed in all
Mm-hmm.
facets of
Mm-hmm.
pregnancy.
So what was your experience with the therapy portion?
I'm definitely glad I started therapy back in 2020. Made sure to find a Black female therapist. That was the first time I ever had therapy. And the reason I was really going for grief, which I think we're going to talk about in another podcast, grief of a sibling. And with 2020 and all the people passing away and all of the things, that was a great time for me to be able to sit with my feelings. I think all of us were. But at the same time, when I have these unfortunate losses, because I already have built such a rapport with my therapist, it was like, whoa,
Mm-hmm.
she was aware of the infertility journey, then the babies, and then losing, and then, gaining again. So
Just
I,
FYI, there are like specific therapists that,
yes.
specialize in grief and perinatal grief. So I just wanted to plug that.
Yes, as well as same thing with doulas. There are doulas that specialize just in miscarriage or pregnancy loss, no matter what it looks like, whether it's abortion, whether it's it is by choice or medical condition where you may lose a being in a life. So there are doulas that specialize in that. And I think it's great to have a medical team that will help with that, including therapists, the doula. But yeah, I'll have Brittany continue talking because this is good.
All right, so then we can segue into one of the areas that I'm passionate about is
Yeah.
self-advocacy. So just based on my lived experience and my journey with having a medical condition, so I have lupus, and getting pregnant and having to navigate kind of the interfaces with different doctors. So like when I was pregnant with my daughter, like, okay, so let me back up. Sorry. When when I was pregnant with my son, it was a typical normal pregnancy, no complications. I ended up having a C-section because of what I know now as the snowball of effects of like, going into the hospital too early. So when you go into the hospital too early when you're in labor, sometimes their doctors are wanting to interject medical interventions to help speed up your labor. So, I was given Pitocin. First, I was given like fluids and IV medication, and then Pitocin to speed up. But then my son's heart rate dropped, and so we were, kind of like at a standstill. I was told, in that time that they were going to stop the Pitocin, they were going to start it back. But if his heart rate dropped again, then it was going to be an emergency C-section type of situation, and we were going to have to, go that route. So rather than it being like an emergency situation, I just elected to have a C-section. At that point, looking back on it, I feel like, I probably could have delivered naturally. It was my first child. It just takes time. Your first child takes time, right? And our medical
I have a doula question for you.
Yes.
Do you think now you said thinking back, you would have elected like I probably shouldn't have. Is it because of what you know as a doula and just being
Yeah,
older? Do you feel like you were
absolutely.
pressured into that
Not
choice?
necessarily
Not in a bad
pressure.
way, but like I think this is the only option, and you're
Well,
like, okay, let me
right.
do it.
Right. I think that, our medical system is not based on time. And sometimes babies
They got to
take
get you in and out.
time. Right. So like doctors are like, okay, I got to get this patient, get her delivered, and not necessarily. I don't think they do it in like a malice way. I just think the way the system is designed, right? It's
Yes,
designed
this
to
is
be
what they're used to.
in and out with your patients, get them done, let's go. And especially when you're having your first child, it's going to take time, sometimes more than
Yes.
24 hours. Like I was in the hospital 24 hours or more. Like it's going to take time. So I feel like had I been maybe given that time, or like you said, the things that I know now as a doula,
Yeah.
had no, like if I'm going to do a hospital birth, like wait to go to the hospital. Like
Yeah.
my mom, when I started having contractions, she was like, okay, they're 5 minutes apart. I think she was more so concerned about having like accidentally having the baby at home. So she was like, no, we
Right.
need to go to the hospital right now. We need to go
This is
right
not
now.
TV. We have so much time.
But
We
like you
learned
said,
that.
right. Like you said, we have time, and like spending that time at home, laboring at home, and then going to the hospital when it's time to have the baby, as we learned in our doula training, is like the best option. So, had I known that, I would have, stayed at home.
Yeah.
But so then moving, towards I found out after I had my son that I had lupus, and that was because
Yeah.
I had joint pain, like picking a kid up and down the same way all the time. Like it does a wear and tear
Mhm.
on your body. And ended up
It
doing tests to
does.
find out I had lupus. So when I had my daughter going into that pregnancy, it looked different. Like I knew it was gonna be different doctors aboard on the team, like various
Yeah.
doctors, outside of just a OBGYN or that a baby doctor.
Working.
There was going to be
Yeah.
other people on the team. So I had a cardiac pediatrician, or cardiac
Wow.
a baby heart doctor.
A pediatric cardiologist.
Pediatric,
Okay.
yes, I said I
I was like,
transposed them.
I was like, that, no, that's a lot of words.
To monitor the baby's heart, because we know from research that when people have lupus, sometimes if it's active during pregnancy, it can affect the baby's heart, and it could
Wow.
cause abnormalities in the development of the heart throughout the pregnancy. So luckily everything was fine with my daughter. My lupus has never been active per se. But um so yeah, I, created a conversation guide based on my experience on how to advocate for yourself, because I had
Mm,
doctors on my team that were, dead set on an induction and we need to schedule it. And I told them that I no longer wanted to see them again and I fired them from my team essentially.
that's right. You can
Um,
leave.
because
Thank
that's
you.
not in my plan. Like I understand
Right.
that's gonna give you security or you feel comfortable, but that's not in my plan. So learning just the power of advocating for yourself really helped me to create that conversation guide. And I wanted other women to feel empowered that same way, and feeling empowered to say, hey, I know my baby's, for example, breech. And
Yeah.
you may not be comfortable with delivering a breech baby, but I need to find a provider that is comfortable because that's what I want to do, or that's what I envision for my delivery. I
Absolutely.
created a guide just to give people things to think about as they're going along in their pregnancy and getting prepared for birth. And that's just a passion of mine, even outside of birthing and, having babies, but just in general, like advocating for your healthcare and knowing,
Yeah.
sometimes these doctors, like, the way the system's set up, they're like, okay, you say you're doing this. Okay. Here's this medicine, see me later. But like having that voice to say, I don't like taking medicines. Is there another option? Or, sometimes we hear about doctors just pushing medication before their tests to try to figure out the underlying cause. So here's
Right.
this medication, take this, and then we'll do additional testing to figure out. Like, no, I want to figure out because this medicine might affect something else and cause other problems that in addition to the problem that I have. So let's figure out what
Yeah.
the underlying cause is before I
Right.
start
Before.
taking this medicine.
Exactly. A conversation needs to be had. And I think that's another thing. I think, Brittany, you were working on even before starting the doula work. And like
Right.
I was already, we talked about it how like we were already advocating for other people, for
Right.
ourselves, and not realizing already acting in the role as a doula.
Right.
um, but same where it's just like, wait, let's have a conversation. I mean, respectfully, I am paying for my time. So don't disrespect me by like
Right.
just shooing me off and just passing me because you need the bed. No,
And
no,
that's a
no.
good point.
I live here now.
That's a good point. Like I'm hired, you're working for me. I am hiring you as my physician, and we need to get back to that
Let's have a
versus like,
conversation.
I'm the good patient. I got to listen to you. Like, no, like
Yeah,
I'm hiring you. This is what works for me. And let's figure out like, let's work within those parameters of this is my lifestyle and this what works for me. And how can we address whatever is going on?
exactly. I love when doctors say, we work as a team, when I feel more assured when the provider or the nurse is like, we're working as a team, we totally understand. And not like guilt tripping you into it either, as like, okay, if that's what you insist.
Right,
Like,
right.
don't be passive
Like we're
aggressive,
all a
please.
team, and I've been in bursts like that where the
Yes,
staffing was like, we're a team, you're part of this team, we're gonna work together and get this baby here, you know what I
that's
mean, and
my
it's
that's
more
my favorite
inclusive.
kind of births. I love when I'm like, this is gonna be great. We are
Right.
all on the same team. We're trying to get mom,
Right.
baby out healthy and well and alive. Like that's
Absolutely.
it. So,
Absolutely. I also wanted
yeah.
to shout out before we end here, previous provider, Dr. Coviello, Elizabeth Coviello at UNC. She did a really good job of helping me find my voice during my pregnancy with my daughter
Aw,
and letting me know that I had a voice. Because I
love
mean, we
it.
were in a world of a lot of uncertainty at that time with COVID, and everybody's emotions and anxiety was high because we didn't know what was going to happen next.
Literally,
And
literally.
her helping reassure me in that and finding my voice was really the absolute best. So shout out to her. I still I email her and say thank you so much for helping me so I can help other people essentially. So
A shout out. For real. We need a round of applause for those providers. Also, I'm going to make sure I find a button with that. Okay, great.
But thank you for joining us today for Two
Yes.
Dope Black Doulas, and tune in for our next episode. We will see you guys later.
Yes, take care. Thanks, everyone.
Bye-bye.